If you're a man, you're making sperm right now, while you're sitting here watching this, and whatever's going on with you today, however you slept, whatever you drank, however stressed you've been, that's also been happening to those sperm. So whatever ends up in a sample cup 3 months from now is being made as of today. In this video, I'm going to go through a pattern that I see in a lot of men dealing with fertility issues, what it actually means and how it gets worked up properly through tests before anyone jumps to IVF. So we'll go through a standard case, let's say, itself, and then the genetics, the blood tests, the lifestyle side of it, and towards the end, I'm also going to go through the exact supplements, doses, and reasoning behind each one. So if that's what you're here for, please stick around because it is going to come at the end. I'm going to talk through a pattern I see a lot in practice, almost 30 years of practice now. It's not any one couple, but it's a pattern that shows up over and over in slightly different forms. So I'm describing it in a general way rather than as one specific case. But if caught early enough, sometimes it means that a couple never needs to go anywhere near IVF, in vitro fertilization. I'm Dr. Michael, a family physician trained in the UK, and before general practice I worked in emergency medicine, cardiac surgery, ICU, pediatrics, orthopedics, psychiatry. No grand plan behind any of it, just one thing leading to the next, and that's where the channel name comes from. So here's roughly how it goes. A couple comes in because they've been trying for a while and nothing's happening. And almost automatically, the first appointment ends up being focused on her, on the woman. Her side usually comes back fairly unremarkable in these specific cases. Her iron may be a bit low, her vitamin D may be a bit low, and maybe she's already seen a gynecologist and nothing else has turned up. And anything that has turned up is actually easily fixable. And that's a very common pattern in these cases. Sometimes, however, it does go the other way, and of course it may be her results that are the issue, and that's really a different conversation for a different time and a different video. At a male perspective, when I see the semen result, the sperm result, the sperm analysis, that's when things can shift because his side often hasn't been looked at yet at all. Now, what I sometimes find is what's known as oligozoospermia and sometimes severe oligozoospermia, which just basically means a very low sperm count, poor motility of the sperm. The sperm are not moving well, and the shape of them can be abnormal as well. And sometimes it can be so abnormal that the lab can't even put a figure on the percentage of normal sperm. And what is considered normal might sound counterintuitive, but it's actually just 4%. So if you've got 4% normal sperm in the total sample, that's considered in general enough to result in pregnancy. And at that point, a lot of couples may actually get sent straight to IVF, and a lot of the time that's the right call. But before any of that, before supplements, before lifestyle changes, I want to check the genetics first. There's a region on the Y chromosome, the chromosome that makes someone biologically male, called the AZF region, and its whole job is directing sperm production. In some men, small parts of that region are just missing from birth. They're not damaged, they're just not there. And those are called Y chromosome microdeletions, and they don't show up on a standard chromosome test. You'd actually have to specifically ask for them, specifically test for them. And that matters because if the wrong part is missing, nothing else is going to move the needle. You can sleep well, cut out alcohol, eat well, whatever you like, and it just will not change the numbers because it's not a lifestyle issue at that point. It's actually missing chromosomal information. So before asking someone to commit 3 months of changing their whole routine, it's worth knowing whether that's even going to help. Usually the result comes back as clean, meaning no deletions, and there's actually something to work with here. Then, general blood tests, and often testosterone sits on the low normal side, or could be fairly low. LH and FSH, which are luteinizing hormone and follicular stimulating hormone, may be a bit high, which means that the brain is sending strong messages down to the testicles, but it's not getting the expected response back. Other tests could be the blood count, thyroid, prolactin, liver, kidneys, and they are usually normal. So there's no single thing to point to, which means that the fix isn't a medication, but it's actually looking at the entire system and the pressure that it's under. Then one asks what things that do not show up in a lab test. How much sleep are you realistically getting? How much alcohol are you drinking? In actual units rather than the number that people round down to. How stressed day to day and how well that's actually being managed. And the answers tend to follow a pattern. Not enough sleep, more drinking than first mentioned, and stress that isn't really as handled as well as it sounded in the first place. Now, this part's worth slowing down for. Chronic stress is not just how you feel, it's an actual hormonal issue. Sustained stress keeps cortisol elevated, and cortisol and testosterone move in opposite directions. So if that's what's going on for long enough, it suppresses the signal that drives sperm production. Alcohol. This works on the testes separately. It's actually a direct toxin to the testicles, and it affects the cells that actually produce the testosterone in the first place and pushes more of the conversion towards estrogen than to testosterone. And it also directly damages the DNA of the sperm. I'm not talking here about heavy drinking. I'm talking about what most people are considering normal. So a few drinks here and there most evenings. Now, put those three things together over a few years: poor sleep, regular drinking, ongoing stress, and you get a fairly predictable effect on sperm quality, even though day to day none of it actually feels significant. So the approach has three parts: lifestyle changes, supplements, and a fixed time before we reassess. Alcohol has to come off completely for the entire length of it, not just to cut back. The reason it's all or nothing is that sperm takes somewhere around 70 to 90 days to mature. So whatever shows up in the next test was actually produced under whatever conditions were set up over that stretch of time. Sleep is an absolute priority, since testosterone production is tied closely to deep sleep specifically, and not just the total number of hours in bed asleep. It's not unusual that someone requires to have a sleep study, and this may identify an actual cause for their altered sleep. And on a side note, but very importantly, alcohol causes abnormal sleep architecture, as do certain sleeping medications, and this may all need to be addressed along the way. Now, for stress, I usually suggest box breathing. Breathing in 4 seconds, holding in for 4, breathing out for 4 seconds, and then holding for 4, and doing this multiple times a day. This engages what's called the parasympathetic nervous system, which counteracts the stress response, and the body genuinely doesn't prioritize reproduction if it thinks it's still under some kind of threat. So that's as much as a part of the plan as anything taken as a supplement. And in addition to that, I encourage daily exercise, whether it's walking around 8,000 steps per day, mixing this with resistance training and some more energetic training such as zone 2 cardio, which is the kind of exercise that leaves you very slightly out of breath if you're talking while you're doing that exercise. Now, on the supplements themselves, here's what each one of them is meant to do and what the evidence actually shows. L-carnitine, 2 to 3 grams a day. Sperm rely heavily on mitochondria for energy, and carnitine helps to get fatty acids into the mitochondria to be used as a fuel. Now, there's decent trial evidence here, and it's probably the strongest on the whole list of supplements, which shows improved motility and concentration of the sperm. Coenzyme Q10, 200 to 300 milligrams a day, also involved in that same energy production process, with some antioxidant effect too. Now, trials show improvements in count, motility, and sometimes morphology, as well as in DNA fragmentation, which matters because damaged DNA raises the miscarriage risk even when conception has actually occurred. Zinc, to take daily, 25 milligrams. Seminal fluid, the fluid that the sperm swim within, has got roughly 10 times the zinc concentration in blood, and it's involved in testosterone production and protecting sperm DNA. It's worth knowing also that a lot of over-the-counter fertility supplements pack in 50 to 100 milligrams, and long-term high doses of zinc deplete copper, which causes its own problems, and 25 milligrams is enough. Selenium, roughly 2 Brazil nuts worth per day rather than taking it as a capsule. Selenium's part of what makes the sperm tail move, so low levels are linked to reduced motility, and 2 Brazil nuts give close to a full day's requirement, if not a bit more. And that's also in a way that it's just coming straight out of the food. Omega-3, 1 to 2 grams of combined EPA and DHA daily. DHA is a structural part of the sperm membrane, particularly in the head, which is the part that fuses with the egg. And lower sperm counts tend to line up with lower DHA in the membrane, and supplementing shows real improvements in motility and morphology. In food terms, that's like eating a couple of tins of sardines in a week, or the equivalent in salmon. Vitamin C, 500 milligrams twice a day, not once a day, because vitamin C is water soluble, so it's excreted through the kidneys. You need to maintain it twice a day, so morning and evening. Seminal fluid has several times the vitamin C concentration of blood, which reflects how much oxidative stress that environment deals with. And trials show improvements in count and motility, especially where oxidative stress is already high. Then there's vitamin E, alongside with the vitamin C, up to 400 international units per day. It works with the vitamin C protecting cell membranes rather than the surrounding fluid. Best not to go above 400 micrograms. NAC, N-acetylcysteine, 600 milligrams a day. It's a building block for glutathione, the body's main internally produced antioxidant. A study that was done in 2016 showed improvements in the sperm count, in motility and morphology over a 3-month period compared to placebo. Now, this is a modest effect, but it's a low-risk thing to do. Vitamin D3 only if it's actually low, and the test for that is vitamin D25OH. It plays a role in testosterone production, and it's worth including where deficiency shows up on bloods. But if the level's normal, then there really isn't much case for adding even more. The aim is for a level of between 40 to 50 nanograms, or it translates into 125 millimoles per litre, I should say. Now, none of these on their own carries overwhelming evidence, but the overall research does point to oxidative stress being a real factor in sperm quality. And doing this alongside the lifestyle changes makes sense as support for the system and not a replacement for the rest of it. And then there's the last part. It's actually setting a date, so giving 90 days and then repeating the semen analysis, because without that fixed point, there's no real way to know whether any of it made a difference. 3 months on, what tends to come back is a clear change in morphology specifically, and sometimes from a result that the first lab test couldn't even quantify. So you get from that to something that's actually measurable, and it may still be a little bit below the normal, but often there's a real shift within just that one cycle of sperm production. And in cases like this, I've often seen couples become pregnant. I've seen a woman become pregnant without any other help needed. Now, I really want to be careful how I frame that part. It's not possible to say which piece of it made the difference, the alcohol, the sleep, a particular supplement, or the combination of all of it. It's a pattern from years of seeing it in clinic, not a controlled trial, and it does not prove any single intervention worked. What it does show is that when you take away what's actively working against the system and support what it's short on, it can sometimes recover on its own, which makes sense when nothing's fundamentally broken in the first place. Now, I've seen this pattern often enough that I check for it now before referring most people straight into IVF. I think it's also important to tell couples that, the whole process is supposed to be fun and loving. And that can also make a difference that we won't go into at the moment, but I definitely think that that's a part of the times that this succeeds. Now, a few points worth taking from this. Male factors are involved in roughly half of couples who struggle to conceive, and the initial workup so often focuses entirely on the woman, partly because male infertility usually doesn't show any obvious signs beforehand. If a semen analysis comes back badly abnormal, it's worth specifically asking about a Y chromosome microdeletion test, since it isn't always ordered automatically and it changes whether lifestyle changes are worth trying at all. Alcohol, sleep and stress aren't background details, they directly affect sperm that's being produced continuously and not just on the day of testing. Supplements support a system that's otherwise being looked after properly. They don't make up for a lifestyle working against it. And setting a time frame matters. Test, change what needs changing, retest, otherwise there's no real way to know if anything happened. Now, of course, this is we're not giving direct medical advice here, but this is rather an informational video, and it's critically important that you discuss these issues with your own doctor. I'm Dr. Michael. I'm trying to make sense of uncommon sense medicine, real clinical situations slowed down enough to find the question that actually changes the outcome. This time, it's when a couple can't conceive, is everyone actually being assessed properly? Full supplement breakdown is in the description and pinned in the comments. If this raised a question for you, please drop it in the comments. Please do pass this on to anyone you know who may be having trouble conceiving. And for the channel to grow and reach more people, I would be really grateful if you would hit the subscribe button and like the video. Until next time, stay well, thank you for your curiosity, and ciao for now.